Good afternoon, distinguished guests, ladies and gentlemen. My name is Patsy, and I'm a 61-year-old grandmother and of two adorable granddaughters. I am a caregiver to my dear mom, Madam Lai, Mary Lai, who is 81 years old and has been suffering from dementia for the past 8 years. This photo was taken with mom on an outing at East Coast Park earlier this year. My sharing of my caregiving experience is described in 3 phases: discovering, adjusting to dementia, and loving dementia. Discovering dementia. My caregiving story began in 2006 when my mom started to show symptoms of dementia. She was 72 years old then and lived with me. I am her only child, so we are a very close-knit family. My mom is a loving mother and a spriteful grandmother who was born into a poor family before the war. She went through great struggles in life and made countless sacrifices to raise me up as a single parent. She's illiterate and is a role model of the unconditional love to her family. She has a strict code of conduct of moral values inculcated during her growing years. Mom helped raise my 2 sons while my husband and I held full-time jobs. Before the onset of her illness, she was a master chef, a wonderful great cook, and a disciplined organizer in the household. Her favorite game was mahjong. Don't you think so? Those times, those days, it's a killer, yeah. And she was very good at it. She maintained her health through careful diet and daily walks. At 72, she was still in a pink of health, and it came as a rude shock to us when we noticed a sharp change in her behavior that year. She started displaying increasing forgetfulness and was easily irritated, even paranoid about her possessions, in particular her money. We had to constantly respond to her new behavior day and night. Her paranoia seemed to give her this boundless energy. She became increasingly aggressive in her words and actions. She got lost and did not know her way home. When we realized that she was missing, we frantically went out looking for her. From then onwards, I made an identification tag for her so that we could be contacted in case she went missing again. The trigger point of my caregiving journey came just after Christmas in 2006. In the middle of that night, Mom suddenly got upset with no reasons. She tried to use a cleaver to chop down my wooden bedroom door to get my attention. Yes, it was really very shocking to me. My son, who's with me today, my eldest son, Sean, who's sitting in front, he was 26 years old then. He managed to calm her down and take the knife away. We have never imagined that she can be so aggressive. She was no longer the gentle, loving person I knew. Mom was physically abusive and violent that night. We had no choice but to call in the police and requested the paramedics to restrain her. She was then admitted to the hospital for observation. We had an early appointment for her to see the geriatric doctor. After 2 weeks of observation in the psychiatric ward, the doctors diagnosed that Mom showed signs of dementia, and subsequent tests suggested that it was also related to Alzheimer's disease. This was how I came to learn about dementia. I would say we were unprepared for Mom's sudden dementia initially. Initially, I was frustrated and angry with myself. I felt guilty and was in despair as there was nothing I could do to help her. Had I neglected my duty as a filial daughter and failed her? Should I have spent more quality time with her? Looking back, I wish we were more conscious about dementia and knew about the warning signs like memory loss, lack of self-awareness, confusion over time and space, and mood swings. We had no one to turn to help her back then, other than the hospital staff. There seems to be far less awareness about dementia at that time, and few people would openly talk or share about it. The second phase about adjusting to dementia, I began to learn more about dementia, the type of medication she was prescribed, to control the symptoms, that is her emotions, depressions, and mood swings. There is currently no cure for dementia, but we are hopeful there will be one in the near future. The most painful and difficult decision was for me to decide whether to have mom home cared or placed in a nursing home. Questions I had to consider. How can we manage her erratic behavior and administer her medication properly? Could we do this better if she was home cared or if she was placed in a nursing home? I wanted to be a filial daughter and care for her at home. But my family feared a repeat of her aggressive behavior, especially when there's no carer at home during that day. After much thought and discussion with the family, we agreed that the best option was to have her home cared. Yeah. The nursing home could provide, was to have her to have her stay at the nursing home based on her present condition that time. The nursing home could provide her a safe and better quality with 24 hours surveillance. I learned about the basics of caregiving, largely through trial and error. Little did we know that caregiving training was available. Each episode was challenging, mentally draining, and physically exhausting. But it came easier over time for us. We managed to make adjustments and sacrifices in our daily lives. We visited Mom several times a week and took her out to visit her close relatives and also to her familiar eating places. She always looks forward to our outings. We worked closely with the nursing home and monitored her daily routine, progress, and behavior. It was not always been easy for my mom too, as she went through a difficult transition to be in a nursing home, especially for the first 2 years there. She felt abandoned by her loved ones. She was confused and very frustrated with herself and her family. She hated hospitals and homes. To her, children abandon their parents there. She had on many occasions indicated to me that she wanted to end her life as she does not find any meaning and purpose to continue on living and did not want to be a burden to us. I slowly experienced caregiver burnout and stress. I was physically and emotionally drained, coping with a full-time job and shuttling between home, work, and the nursing home. But I'm thankful to have support from my husband and sons as they took turns to spend time with her. Mom looked forward to our visits at home and was sad whenever we had to leave. We made sure we took her out once a month and always assured her we loved her. The outings with Mom was always challenging and tiring, but we felt it is important for Mom to spend as much time as she could with her family. We knew that dementia can be a slow, dilapidating process, and we have seen the deterioration in my mom over the past 8 years. She now relies on full living assistance. She's on a wheelchair bound. She chokes when she drinks water or any fluid because her throat has really shrunk. And I learned how to prepare soft pureed food meals for her. Putting aside our struggles and challenges, we treasure every moment we can with my mom. We have come to love dementia. Every moment I spent with mom was precious, especially on days when she was lucid and happy. One of the most memorable moments was enabling my mom to witness her grandson's wedding. We are also thankful that she had lived to witness the birth of her 2 great-granddaughters, who gave her great joy each time they visited her. Most importantly, we care and love Mom for who she was before the onset of dementia. For long-term illnesses like dementia, we need to separate the illness from the person and care for them. In this, I mean that we should still continue loving her as she was, to put aside the illness that she's going through. Mom is now home cared, as we would like to help her age gracefully and with dignity. There are 4 lessons that I would like to share from my caregiving experience. Firstly, be prepared. Dementia can happen to anyone, not just the old, but also the young people. YOD, or young onset dementia, is on the rise now. We have to be mentally prepared to become a caregiver and to be on the lookout for the warning signs of dementia. Secondly, you are not alone, as all the speakers are reminding all of you. It can often be a lonely journey for a caregiver who spends much of his time or her time around the care recipient. Try not to do it yourself alone as a caregiver. Gather the courage to seek help from your family, friends, and the community. Share with others about your challenges. In turn, you also will enjoy and get help from them. Today, there are many support groups and other resources available that provides caregiving training, music, outdoor therapy, activities, and other courses like ADA, Alzheimer's Disease Association, AWA, CAL, and many others. You can receive support and comfort from another caregiver. Your sharing and encouragement may touch and benefit another fellow giver too. Thirdly, take care of yourself before you can take care of take care of others. To be an effective caregiver, you must first be aware of your own limitations and learn to care for yourself first before we can care for our loved ones. This is especially important for caregivers of dementia patients, as dementia is a long, long journey. Caregivers must take active steps to prevent burnt out and build up their physical and emotional endurance. Make sure you get some time out to recharge. Don't feel guilty, you're entitled to that time out. Yeah? And lastly, aging gracefully with dignity. We must do our best to accord dignity to our elderly, especially for dementia patients like my mom, who deteriorate both physically and mentally and require full assisted living support. Mom has now lost her voice, her vocals, and most of her mobility now. I've often found tears in my mom's eyes whenever I'm there with her. They are tears of happiness and joy, as she's unable to express herself in words or actions to us. My mom's experience with aging has also prompted me to take active steps to age gracefully. I now pay attention to my physical health and mental well-being. I make it a point to always review, replan, and reset my current situation, be it financially or emotionally. Do ensure that you have at least a basic health policy or coverage, a power of attorney, so that you will not be a burden to your family or children. My caregiving experience journey has been a roller coaster experience the last 8 years. We were not prepared for my mother's quick fall into dementia, and our lives have completely changed since then. There are many times when we felt helpless when confronted with the challenges of dementia, but I am grateful for the strong support from my family and friends. We continue to learn and adjust along this caregiving journey. In closing, I would like to thank all of you for listening to my sharing, and I'd like you to invite to read more about my book, Burden No More, which shares in-depth of my care journey outside this room. Thank you and God bless. Prepared for my mother's quick fall into dementia, and our lives have completely changed since then. There are many times when we felt helpless when confronted with the challenges of dementia, but I am grateful for the strong support from my family and friends. We continue to learn and adjust along this caregiving journey. In closing, I would like to thank all of you for listening to my sharing, and I'd like you to invite to read more about my book, Burden No More, which shares in-depth of my care journey outside this room. Thank you and God bless.